It's no secret that quitting smoking significantly reduces the risk for a wide range of diseases and early death. Yet, tobacco use remains the leading cause of preventable death and disease in the US. The good news is smoking rates have decreased over the past decade and are near historically low levels. In 2021, 14% of adults smoked cigarettes. However, not all Americans are benefiting equally from this decline. Certain parts of the country and populations continue to smoke at high rates, highlighting the uneven progress where we need to do a better job of preventing and reducing tobacco use. In this video, we explain what are the top 10 populations disproportionately affected by cigarette smoking and tobacco use. So, let's go to the video. Adults that live in rural areas. Adults that live in rural areas smoke at a rate of 14.4% compared to 11% among adults that live in urban areas. They are also more likely to be heavier smokers, smoking 15 or more cigarettes per day compared to smokers in urban areas. Kids in rural areas are also more likely to start smoking at a much younger age and smoke daily, making addiction more severe and smoking harder to quit. Adults living in traditional tobacco growing states. The average smoking rate in traditional tobacco growing states, Georgia, Kentucky, North Carolina, South Carolina, Tennessee, and Virginia, is 16.9%. But this hides significantly higher smoking rates in several of the states. For decades, tobacco industry influence has blocked tobacco control policies in these states. However, there has been some progress on tobacco control policies and smoke-free laws at the state or local level in many of them in recent years. Military veterans. Military veterans smoke at a rate of 21.6. That number jumps significantly in certain age groups, the highest being a shocking 50.2% among male veterans aged 18 to 25. Sadly, the military has a long history with tobacco use, including cigarettes previously being included with rations. Many veterans report beginning tobacco use in the military or reinforcing their tobacco use during their service. Lesbian, gay, bisexual adults. LGB. LGB individuals have a smoking rate of 19.2%, meaning about 1 in 5 LGB adults smoke cigarettes compared with about 1 in 7 straight adults. While we don't have good national data on smoking among transgender individuals, LGBT individuals often face risk factors such as daily stress related to prejudice and stigma. The tobacco industry has aggressively targeted and marketed to the LGBT community, advertising in publications aimed at LGBT audiences and depicting tobacco use as an accepted part of LGBT life. Adults that did not graduate high school. Adults with lower levels of educational attainment smoke at higher rates than the general population, and smoking rates decrease significantly with increased education. Adults who did not graduate high school smoke at a rate of 21.6%. Adults who did graduate high school smoke at a rate of 19.6%. And adults who graduated with an undergraduate degree smoke at a rate of 6.9%. Americans making less than $35,000 a year. Americans making less than $35,000 a year have a smoking rate of 21.4%. People living in poverty smoke cigarettes more heavily and smoke for nearly twice as many years as people with a family income 3 times the poverty rate. Lower income cigarette smokers suffer more from smoking-caused diseases than smokers with higher incomes. Tobacco companies often target advertising campaigns toward low-income communities, and a higher density of tobacco retailers can often be found in low-income neighborhoods. Uninsured Americans. Uninsured Americans smoke at a rate of 22.5%, more than double the rate of adults with private insurance, whose smoking rate is 10.7%. Research shows that gaining insurance coverage increases the odds of quitting smoking due to more primary care visits, follow-up smoking assessments, and smoking cessation medication ordered. Indigenous peoples. Indigenous peoples, American Indians, Alaska Natives, smoke at a rate of 20.9% and have the highest prevalence of cigarette smoking among all racial ethnic groups in the US. For the Native community, it is important to distinguish between commercial tobacco use and tobacco use in traditional ceremonies, as some members of Native communities use tobacco for ceremonial, religious, or medicinal purposes. Americans with mental or behavioral health conditions. Individuals with generalized anxiety disorder smoke at rates of 21.5% for those with mild symptoms, 27% for those with moderate symptoms, and 34.5% for those with severe symptoms, compared to 12% among those with no or minimal symptoms. Rates can be even higher among those with other mental or behavioral health conditions. Even more alarming is that people with mental health conditions make up 22% of the population but account for 36% of all cigarettes smoked. Nicotine's mood-altering effects can also mask the negative symptoms of mental illness, putting people with mental health conditions at higher risk for nicotine addiction and cigarette use. Adults in public housing. Adults living in public housing smoke at a rate of 33.6%, more than twice the national rate. Second-hand smoke is also a pressing issue in public housing, since the movement of second-hand smoke between units cannot be controlled in multifamily buildings. In July 2021, the Department of Housing and Urban Development (HUD) implemented a rule requiring all public housing authorities (PHA) to have smoke-free policies in place to protect residents, staff, and guests from second-hand smoke, which may also prompt some smokers to quit. In this video, we discussed about top 10 populations disproportionately affected by cigarette smoking and tobacco use. If you got this video helpful, please give a thumbs up to the video. Don't forget to share this with your friends. Subscribe the channel for more important videos like this. Thanks for watching.